The next topic is going to be around nutrition, which has always been a topic. Every year we've done this and always very engaging for the audience. Dr. Northfelt is one of our breast oncologists, but also hematologist by trade. Truly, he's done almost everything there is to do in the realm of cancer. And he's going to moderate this session, which I think you'll find will be very interactive. We have three panelists here who are from the nutrition service here at Mayo Clinic, and I mean, really, they can answer almost any question that you might think of or even not think of with regards to nutrition and cancer. So, thank you.
You've all probably noticed that there's a theme this morning, and what is that theme? It's about you. We're talking today primarily about the things that you all can do to help yourselves avoid cancer, to deal with a cancer problem if you have it, or to remain cancer-free if you've conquered it. So really everything today, I think, is tied together by the idea that we're going to talk about things that you all can do for yourselves, or we can do for ourselves, when it comes to avoiding cancer or dealing with a cancer problem. And there's nothing more vital, I would say, to that personal approach to dealing with cancer problems than thinking about what you eat every day. Anybody who's come to see any of our consultants at the Mayo Clinic about a cancer problem knows that they're going to hear something about, or knows that they've heard something about their nutritional lives as a part of their addressing cancer. So we wanted to bring that to the big session today for a more detailed discussion, and I have colleagues with me who are going to help me in this. This is Terri Taylor. She's from the Cancer Center at Honor Health in Scottsdale, and she's been their go-to person for nutritional counseling for a number of years. A lot of you have probably met her, and we're really grateful to have her here. Clarissa Goetzinger is in our Cancer Center at Mayo Clinic, providing the same kind of nutritional advice, and it's almost impossible to get in to see her because she's so busy. She sees, or she should see, everybody who comes to our cancer center, because everybody who comes to see us needs to understand about how nutrition can support them in their cancer journey. And this is Laura Loch, who's also in the Cancer Center at the Mayo Clinic and provides those same services, very thoughtful, detailed understanding of nutrition applied to cancer problems. So we're going to try a session here where this is going to be a little bit like walking on a high wire with no net. And that's because I'm going to ask these very skilled people a series of questions about cancer, get their answers that I think will be informative to all of you. But I've not told them what the questions are going to be. So this is going to be completely out of nowhere that they're going to be hearing these questions. And what I'll do is I'll ask each of them to say go or no go on the question that I'm going to ask. And after they've all had the chance to answer, we'll ask them to provide a little more detail about why they said go or no go. So everybody ready? Okay. So I'll start, Terri, with the first question, which is keto diet, go or no go? She says no go. No go on the keto diet. All right. Clarissa, keto diet, no go. No go. Laura, keto diet. Oh, a little hesitation, but no go. Let's go back to Terri. Why did you say that, Terri? Why did you say no go on the keto diet for cancer?
Dr. Northfelt, this is a very, very hot topic when we look at many different things. When we look at the keto diet, really the only research-supported area for that is in glioblastomas as part of the treatment. Other than that, we don't have endorsement from any of the major oncology networks at this point. What I can say is if we're looking at keto, we really need to look at what kinds of food choices you're making, because a lot of times it can be very high in things like cured, smoked, and processed meats. It can be very low in fiber and plant foods, and those are things that we know through research are very important for reducing cancer risk and recurrence.
Clarissa, anything to add about the keto diet? Why did you say no go?
Well said, Terry. Thank you. I am saying no-go because I believe that the keto diet, even though in some cases it may be beneficial, but I think it can be very hard to live by. It can reduce your quality of life, as well as, like Terry was saying, you can miss out on a lot of nutritious foods.
Laura, pretend that you're President Trump and you're going to communicate to us in 260 characters. What do you have to say about the keto diet?
Oh gosh, with that as inspiration, I think I think my answer would be, if I had to be on the keto diet and I couldn't eat some of the fruits or bread or pasta that I like, that's not going to work for me.
I want to stay on the same theme for a minute, so I'm going to ask Clarissa, go or no go on the paleo diet? She says no go. How about Laura, go or no go on the paleo diet? No go. And Terry? No go as well. All right, Laura, tell us, what is the paleo diet?
Well, the paleo diet is based in what we think of as a diet that hunter-gatherers would typically be eating. So things found naturally in your local environment, very simple foods, unprocessed, however, also can be limiting, and that is a challenge for a lot of our patients.
Clarissa, you said no go. Why did you say that about the paleo diet?
In my opinion, it would be fairly similar to the keto diet, whereas with, like Laura was saying, it's very hunter-gatherer, so it's going to be higher in the animal proteins, red meats, maybe more processed meats. So that can be a difficult way to approach your diet, as well as then maybe not getting as much plant-based foods as well.
Terri, anything dangerous about a paleo diet for somebody concerned about cancer?
My biggest concern with the paleo would be, of course, that a lot of the whole grains are neglected in those types of eating plans. And we know that the whole grains, again, a lot of research has shown that whole grains are reducing the risk of breast cancer and reducing the risk of hepatocellular cancer. Also very important for heart control and heart disease to be eating some of those whole grains. So I would think the biggest concern with that would be neglecting the intake of some of those whole grains. Some benefits would be, yes, you're going to eat a lot of vegetables from there, which is a good thing. But again, my concern would be missing out on those whole grain products.
Clarissa, soy, go or no go? Double go, double go. Laura, alcohol, go or no go? She says no go. All right. Terri, what about, vitamin supplement, go or no go? She says no go. All right, let's go back to Clarissa. I think I gave you soy. You said double go.
Yes.
Why is that?
Well, as many of you may have heard about or have been reading, soy is very controversial, I think, right now. Soy can be very, very beneficial in your diet. It's a plant-based protein. It's a part of the anti-inflammatory diet. It is not harmful, especially when we talk about breast cancer. That is not something that we need to worry about anymore. There's lots of research done with soy lately, and there is no harm to your breast cancer. Even hormone-positive breast cancer, it is completely healthy.
What about the guys concerned about prostate cancer? Is soy a go or no go for prostate? Double go, double go.
Yes.
All right. Laura, you had alcohol. What do you think about alcohol being a no-go?
Well, alcohol is an inflammatory food, so it's going to cause more of an inflammatory response in your body. We can recommend a limitation of no more than 0 to 1 drink per day for women and no more than 0 to 2 drinks a day per men, knowing that that alcohol is going to have more of an inflammatory and less of a beneficial effect in your body.
Terri, how am I going to get vitamins if I don't take a vitamin supplement? You said no go.
So what we want to do is we want to push foods first, because it's not only individual vitamins that are actually providing the protection to reduce risk of cancer and cancer recurrence. It's a combination of things in foods. We have plant-based compounds like phytochemicals that are not found in vitamins. There are some indications for certain vitamins, people that are deficient, if you've had a type of surgery which interferes with the absorption of some of your vitamins, of course that would be an indication. Or if we're looking at low vitamin D levels, vitamin D is very important, we think, for reducing some cancer risk. So again, when we're looking at general population, we're trying to do foods first rather than just relying on supplements themselves.
Let's talk about intermittent fasting. Intermittent fasting is something I get asked about quite often. This is where somebody deliberately eats nothing for 13 hours or 14 hours in a day. Terri, intermittent fasting, go or no go? She says go. How about Clarissa? No go. There's a little controversy stirred. How about Laura? Go or no go on intermittent fasting? Oh. Okay, well, we're all sufficiently confused now, so maybe, Laura, you could start out by explaining your up and down attitude.
Intermittent fasting has been used forever, for thousands of years, as a way to improve someone's diet or metabolic response to foods. However, that can be a detriment to someone who is at risk for things like low blood sugars, or someone who has trouble meeting their needs when they are in that window of a time that they can eat. In addition, I've also seen some patients take too much advantage of that time when they can eat, so the roller coaster is not quite balancing out.
Clarissa, I think you were a
No.
no-go. No-go. Okay, explain yourself.
Okay, so intermittent fasting. In the world of oncology, what I think about is, can you hear me? What I think about is what maybe you're going through treatments that make it difficult to eat at periods of the day, maybe certain days, so that intermittent fasting can be a little bit more restrictive on certain hours of the day. If you are struggling to get the nutrients regardless, I think you need to take advantage of any hour of the day to get the nutrition you need and not put limitation on those hours.
Terri, I believe you were a go on intermittent fasting. Explain.
So my concern is, again, I'm looking at it from a health standpoint, and I deal with a lot of clients who are struggling with weight reduction, especially after a breast cancer diagnosis. We know that when you're intermittent fasting, that lets your body rest. There's something called circadian rhythms where your body really needs to have the time to rebuild. We find through research that if you have that period of time when you're not eating, it really helps to reduce insulin resistance and some of the hormone productions that may be detrimental to cancer cell growth. So again, I think it depends. If you're talking like my colleagues on episodes where we have clients who are undergoing treatment and trying to eat a lot of calories to keep their weight up, that is a separate type of situation.
All right, Clarissa, vegan diet, go or no go? No go. Laura, vegetarian diet, go or no go? She says go. Terri, dairy foods for people with cancer, go or no go? A go. All right, Clarissa, you had vegan, right?
Yes.
And you said yes.
No, I said no.
Oh,
Yes.
I need to pay more attention. All right.
I'll keep my thumbs
why
down.
is a vegan diet a bad idea when you're talking to a cancer patient?
I think there's a time and place if you are already maybe very motivated to do a vegan diet, that you can make that a very healthy diet. However, in the oncology world, if maybe you're trying to start out and maybe dabble in vegan, it can be very restrictive. A lot of times if you're starting out, you'll definitely need to talk to a dietitian to help you make sure you're getting enough protein, the right proteins, so it's a balance. You know, there is a time and place for that vegan diet, but overall, I would say generally have a balanced diet, be open to eating a variety of foods instead of being so restrictive.
Laura, vegetarian diet, I believe, was a go from you.
Yes, Dr. Northfelt, and I believe that that is a very healthy diet for our oncology patients. Again, building on what Clarissa's very well pointed out, that protein is an important part of the diet, and we need to make sure we're meeting those needs, which we can do with our plant-based proteins like soy. However, vegetarian diet may not be for everyone, so again, looking at the reality of sticking to that diet is appropriate.
Terri, why is dairy a go for cancer patients?
When we look at dairy, again, that is a nice protein source, which my colleagues have brought out as well. When we're looking at dairy, some of the concerns are the saturated fat or animal fat that's in there, or some of the hormones that might be in there. We know that dairy products can be very good sources of calcium and vitamin D, which has been very important in certain things like maintaining bone density after certain types of treatments, and also in reducing colorectal cancer risk. So I think when we're looking at dairy, we can't totally neglect it, maybe making the right choices through that area, but not totally eliminating it.
Laura, cheeseburgers, go or no go?
Well,
No, she said no. Clarissa, hamburgers, go or no go? Is that with or without fries? No? All right.
either way, what kind of burger are we talking about?
Yeah, right. What kind of burger?
Terri, pizza, go or no go?
It depends on the time.
All right,
These are hard questions, Dr. Northfelt.
Not black and white.
I think I need to get an explanation about the pizza answer. Explain that, please.
So my concern with pizza would be what's the topping on the pizza. So we know that there's a high cancer risk with cured and smoked and processed meats, so pepperoni and sausage may not be your best choices, but certainly there are great choices where you can put a lot of vegetables on there and do a thin crust that's whole wheat, and we need to enjoy our food as well. You know, it's patterns of eating. It's not one food, and that's the all or nothing.
Let me ask all three of you for a response to this. Marriott Resort breakfast, was that a go or a no-go?
I don't know
What was for breakfast?
we don't know what was for breakfast.
Oh, they all arrived late. I
ate
guess
our
we won't get an
breakfast
answer.
at home.
I guess we won't get an answer to that. Does anybody in the audience need an explanation about the cheeseburger answer? Everybody? I don't see any hands. I think everybody is kind of on that. Oh, really? Okay, Laura, I think you said no go on cheeseburger. Explain.
I did, and with a heavy heart, but as Terri pointed out, you know, our intake of our processed meats, including a high intake of red meat, can be more inflammatory to the body, so we're going to try and keep that pretty low. However, kind of like the pizza example, if we can find little ways to make that burger a little healthier, maybe a little bit of a leaner cut, you know, choosing some vegetables to go on top, we could probably get away with a little bit of red meat in the diet, but the recommendation is to keep it less than 18 ounces for the week.
Terri, tap water.
Oh.
Okay. Clarissa, mineral water. Laura, vitamin water. Sure. Okay. So does it matter how we hydrate? Terri?
Hydration is very important regardless. You know, when we're looking at water, if you are neutropenic, yes, then maybe tap water isn't the best choice if you're undergoing a bone marrow transplant or something like that. But other than that, we really don't find any problems with drinking those types of waters. And when we look at alkaline water and some of those things, really the effect in the body is minimal because the acid-base balance of your body is regulated by your kidneys and by your lungs rather than by the water that you drink, unless it tastes better and you want to drink more.
Clarissa, you said go on mineral water.
Yes, if you like mineral water and that is how you can hydrate your body, go for it.
Laura, go on vitamin water?
Are we talking vitamin water, the brand vitamin water?
Well, vitamin water where there's a fancy, colorful label on the bottle and it costs about 3 times as much as regular water. That kind of water.
Man, I'm wishing I invested stock in vitamin water. No, I agree with my colleagues. Any way we can hydrate is a great option. Where I work for my oncology patients, taste changes can be a big challenge. So if a little bit of flavor goes a long way for you, then that's going to be fine for me. However, I wouldn't say that there's a need to choose that extra cost in water. Does smart water make people smarter? I don't think so.
All right, let me get Clarissa to answer a question about alkaline water, though, because a lot of cancer patients hear about alkaline water, and I think we need to address that.
There is no changing the pH of your bodies. Like Terri mentioned, your kidneys, your lungs will do that for you with the homeostasis. Your body has that set point. You do not want to change that pH. So choosing an alkaline water is not going to help cancer risk or the cancer that you may already have. But if you like the flavor, go for it. If it's still going to help you hydrate, that's one thing. But don't choose an alkaline water thinking it's going to change the pH of your body.
I'd like to get a comment from each of you about where you think people should eat when they have cancer. Do you have any advice to give a patient or somebody concerned about cancer about the environment in which they enjoy their food? Don't tell me I've stumped you. Come on.
Are you talking about as far as what restaurants to eat or where to eat in the home?
Should I eat at my desk, in front of my computer, in the car, out in the hallway here, with my family, without my family?
So I really enjoy talking about mindful eating, and this is a great topic for that. I think especially when we talk about survivorship, we want to try and reduce weight gain, keep a healthy lifestyle. And I think, Dr. Northfelt, this is a great topic because we do want to encourage enjoying your food at a table, at maybe a dining room table where that food is appropriate. We don't want to eat with distractions. We don't want to eat driving or watching TV because your brain cannot multitask. You would be thinking about what's on that TV and not on the food in front of you. So most people will end up overeating if they're watching TV or doing whatever else because they're not paying attention to how full they're getting.
Terri, coffee, go or no go? It's a go. Clarissa, coffee, go or no go? Laura, coffee, go or no go? Laura, explain.
Coffee has been shown to have some wonderful anti-inflammatory benefits for the body, especially patients with cognitive or liver diseases. So I would suggest, keeping it in moderation, 1 or 2 cups a day, and really watching what's going into our coffee, not the coffee itself.
Clarissa, anything to add?
Yes. Great points. Coffee can be very beneficial. It can even help constipation. But we also have to look if you are struggling with dehydration, you don't get enough hydrating fluids, that coffee also contains caffeine. So we do want to make sure if you're drinking coffee, it's not taking the place of a hydrating fluid.
Terri, give us a little historical perspective here, because I thought years ago, or even not that many years ago, there was a buzz about coffee causing cancer. What's up with that?
So interesting you think that I would know from years ago compared to the other people on this panel. I could give the historic perspective on it. So I think that now again, when we're looking at coffee, the biggest concerns were what was the source of the coffee, what things were going into coffee. It's the 600 and 700 calorie beverages where a lot of added sugar and added fats to them. We know now that coffee again has many anti-inflammatory and anti-cancer properties, particularly in endometrial cancer and liver cancers itself.
I want to make sure that I leave enough time toward the end here to allow each of you to make a statement. You've all three devoted your professional careers to making sure that cancer patients understand about the value of good nutrition. In 260 characters, Laura, what's this about? Why is nutrition important for cancer patients?
Nutrition is so important for cancer patients because this is a world full of things that we cannot control, and diet is one of the things within our control. So if we can make the best choices possible, that is real in reality for you and your cancer, I think you're only doing the best for your body.
Clarissa.
Food is our fuel. So like Laura said, we can't control maybe the treatments that you're on with the cancer, but you can control the foods that are going into your body. So if we can help you choose the best foods or the better foods for you to make you feel better and get you through this time of your life, that's what our goal is.
Terri, 260 characters.
So it's very interesting because food and nutrition is one of the only things that is addressed in both prevention, active treatment, and survivorship. So it plays a role in the whole continuing of oncology itself. And we know now that we're really focusing on the effects of lifestyle choices on both prevention and reducing risk of recurrence. I would encourage you to make sure you are working with an oncology dietitian. There's a lot of things out there that is misinformation, so we can clear that up. And we need to make this sustainable for you. What works in your lifestyle?
I have one audience question I want to have you address. Clean eating, go or no go? Terri? Clarissa? Laura? Okay, we get a big endorsement from the panel for clean eating. Clarissa, old Twitter, 140 characters. Why is clean eating a good idea? What is clean eating?
So clean eating would be really taking out the processed foods, sticking to the whole foods, fruits, vegetables. So I think I'm for it because it really can be a good, healthy, healthful diet, anti-inflammatory, full of plant-based foods. And really, it's basically taking out those processed foods so you wouldn't be eating the fast food. So there's some definitely good things about that diet.
So what have we been doing this morning, and what will we be continuing to do this afternoon? We're talking about you. We're talking about what you can do about your cancer problem or about the cancer problem of a loved one. We're talking about nutrition. We're talking about emotional well-being. We're talking about physical fitness. We're talking about sleep. A little bit later, you're going to be hearing about marijuana. By the end of the morning, you're going to be happy, hungry, and sleepy. For those of you who are happy, please attend the breast cancer session after lunch because we have a lot of interesting things to share with you there. For those of you who are going to be hungry, there's great lunch waiting for you, courtesy of the Marriott chefs. And for those of you who are going to be sleepy after lunch, Dr. Bryce's session is the one to attend. I want to thank our panel. You know, I have to say, I did not prepare them at all for this. I didn't tell them what any of the questions would be. And really 5 minutes before they got up there, I sort of explained what the format was going to be. So they had no idea what was going to happen when they arrived here today. And actually, they had no idea what was going to happen 5 minutes or even 5 minutes from now. So in my view, they did a remarkable job because they took every question and, yeah. Thank you. Thank you. They're going to be available later in the morning if you want to approach them if you have a specific question about your own nutrition. But let's just summarize this by saying your nutrition is vital vital to your well-being as a cancer survivor, as somebody living with cancer, or as a caregiver who has to remain strong to take care of your loved one. And if you want to avoid developing cancer, these are the people who have the ticket for that as well. So please give a lot of thought to what you're eating. Remember what they've told you about the various topics we've discussed today, and they'll be available later for questions as well. Thank you all for your attention.